Well, what the heck does chiropractic have to do with asthma? In our past video, we talked about how the neurospinal system works. So now we're going to talk a little bit about why chiropractic care is so important. Many of you have probably been to a chiropractor before. If you are patients in this office, obviously you know how this works. But if you have been to a chiropractor before, but you've never heard how chiropractic care can help with things other than back pain and neck pain, listen up. This is where the rubber meets the road, guys. And if you have kids who are asthmatic, who puff on an inhaler on a daily basis or puff on an inhaler in emergencies all the time, this is especially for you, okay? Subluxations, which are misalignments in the spine, are extremely common, and they're becoming more common as life becomes more stressful, as injuries become more ubiquitous, and most importantly, as the birth process becomes more problematic. I talk very frequently in the workshops that I do about birth trauma as being something that's super common now. It shows up in something like 95% or more of the patients that I check in their first couple of months of life, because the birthing process is so foreign to most women. And it's not because women are doing anything wrong. It's because we are genetically selecting away from vaginal birth as we become more comfortable with interventions to birth. And this is research that was published by an obstetrician by the name of Michelle O'Donnell. He's written several books on the topic. It's fascinating. But because birth trauma and trauma as a young child is becoming so common, subluxations, which we call dyskinesias, are becoming all too common. And when a subluxation occurs or a misalignment occurs in the spine, the nerves that come out above and below those subluxations are compromised. Okay, that means that the brain can no longer communicate effectively through those nerves to the organs that they attach to, and those organs, as I spoke about in this last video, won't function the way that they're supposed to. Okay, if those nerves go to the lungs, you better believe that the lungs are not going to be able to inhale and exhale correctly. If those nerves go to the diaphragm is going to be spastic, which is, again, very common in my practice. And you're not going to be able to inhale and exhale by contracting and expanding that diaphragm, okay? Chiropractic is really stinking simple, guys. We do two things when it comes to asthma, and neither of these things has to do with treating asthma, because that's the realm of medicine. We let our medical doctor colleagues take care of the treatment of asthma. We're looking for the underlying neurospinal causes so that these kids can breathe correctly. The first one has strictly to do with posture. If your kiddo spends 6 to 8 hours a day in a desk, and all they're doing is humped over, and we know our kids are spending more and more time in front of screens, we're spending more and more time in school stressing out, our kids are having a hard time dealing with things like anxiety and stress and depression. As a result, this is literally compressing their lungs, and it's preventing them from breathing and exhaling correctly, and it's causing subluxated vertebrae to press literally on the lung tissue, right? You're walking around like this, vertebrae slip backwards, and it's preventing those lungs from doing what they're supposed to do. So it's compressing the lungs, it's preventing breathing. The second and the most important part of this with regards to chiropractic is those nerves that come out from either side of those vertebrae are not communicating to the lungs. Chiropractic is designed to remove that nerve interference by moving those vertebrae back into position, creating enough breathing room for the nerves to be able to communicate so that these kids can breathe correctly. Are we going to see instantaneous changes? No, not by a long shot. Do we see kids take big, deep breaths after adjustments? Yes, because we're starting to restore that normal vital capacity to the lungs. What we're looking for is the long game here. I want to see my patients hold adjustments for long enough that those nerves can start to work better. And when a nerve has been irritated for a really long time, it becomes habit. So we're looking to undo those habits over the course of weeks and months and years so that these kiddos can less rely on their inhaler and more rely on their normal diaphragm and lung function. Okay? So chiropractic, super simple. Remove pressure and irritation off those nerves, allowing those nerves to function a little bit more optimally. It takes some of the stress out of the global nervous system so that the body can breathe effectively, so that kids can start to use their diaphragms and inhale using their bellies. And it prevents them from having as many of these emergencies as we typically see, especially during allergy season, which we're going to talk about in the next couple of weeks. Okay, so if this resonates with you guys, please call our office, talk to Tiffany, our patient coordinator, tell her that you saw this video and that you want the VIP rate for the initial consult. That's $100 for our office. It's saving as much as $100 off of your initial consult. We'll get to the root of it. We'll do a series of nervous system scans to see how everything is functioning, and we'll get to work on helping your kiddo, okay? I love you guys. Please spread the word, and we'll talk to you guys real soon, okay? Love you, bye.